Well, good afternoon and welcome to MedTech Crossroads. Today, Friday, May 27th, 2022, episode 107. After a great time with MEDC last week and the Women Who Innovate series, which we'll be back at again next month, at the end of next month, we return to our series with ArborHive, which we're calling the Clinician's Perspective. Joining me today in just a minute will be Dr. Santosh Mudiraj, who'll be talking to us about the kinds of process challenges that hospital systems face and how they want to go about solving those. But before that, we just want to tell you for a moment here, if my clicker will work, which it's not working. That's what we're in the middle of. There's one more week after this. On June 3rd, we will be talking to Frank Sawyer about hospital processes as well. So we're looking forward to that. And coming in June and July, we are going to be talking about de-risking medical device development. We're going to dive deep back into the education regarding how do you really go about de-risking medical device development process. Also coming up in September, save the date, the Michigan Medical Device Summit, September 20th. It's a Tuesday in Kalamazoo, Michigan, put on by MichBio. It's been off for a few years with COVID, but coming back, that's just such a phenomenal event where the who's who of med device comes and gets together in Michigan. Well, with that, we come to our main event, and I am joined in the studio today by Dr. Santosh Mudiraj. Welcome.
Thanks, Gene, for having me.
It's so good to have you, and representing ArborHive today. We're going to get into some things that I think most people will be really interested in because, like you and I were talking before, there's this sense, maybe 10 years ago, people thought, oh, I'm going to invent something and I'm going to solve a problem and it's going to be great. And that level of naivete, perhaps, we no longer have an excuse,
right? Because
there are folks like you who work inside hospital systems. You know what the challenges are. You know what the clinician's perspective is. You know what the hospital system's perspective is. So we're really looking forward to getting into this today to really understand the problems and the solutions as you see them. But before we go there, why don't you tell us about your background and what makes you you and how you've gotten to where you are today?
Sure, thank you. So my name is Santosh Mudiraj. I am a clinician by background. I practiced medicine 15, 16 years ago, graduated from med school in India, and after that practiced medicine. But I've always been very analytical, had some technical background. I actually even went to engineering school for a minute before going to medical school. And so when I was in med school, as I was practicing medicine in some of the rural areas of India, I realized there was a big gap between technology and healthcare. And so I thought I could do a lot more being on the other side of bedside. So I made the move from bedside to what I call the business side of healthcare. And that's when I moved to the US, did my master's, and one of the things I wanted to do is get myself more experienced in various aspects of the healthcare ecosystem. So whether it's outpatients, outpatient clinics, research institutions, malpractice, as well as hospital systems. So I've been able to get experience there, but also been fortunate to get myself a little bit more educated in the process improvement, Lean Six Sigma world, as well as analytics. So this way, if I have an opportunity or a problem that I notice that I could actually speak with either a process improvement specialist or an analytics specialist, speak their language and be able to translate what's in my head. So using all of that background, I am trying to not only improve healthcare, but empower the healthcare consumer, which in my terms, it is not only your patient or family, but includes your providers, your caregivers, your frontline staff, and the community. So that's me in a nutshell.
Wow, that's really awesome. It's really interesting too that you said you sort of found early on that some of the problems that you wanted to solve had more to do with how the care gets delivered than the specific delivery of care, like that wrapper. And I think as we've talking about it on the show and also in our own personal lives and experiences, oftentimes it is those structural things. It's, oh, I'm here and that caregiver cares about me, but they can't schedule this thing over here, for example,
right,
or something like that. And that's where I think a lot of people today would say they feel the rub. So it's very perceptive that how many years ago when you had that thought originally of your own career?
I guess aging myself about 15 years ago.
Nice.
Yeah, and that's when I had to kind of say, I want to make that move and start on a non-traditional healthcare path.
Yeah, that's really cool. Well, and it puts you in a very unique niche because you're there and you're experiencing the value that the clinician has. You're experiencing the value that the healthcare system has. You're experiencing the value that the patient has. Probably one of the few people who can speak to all of those really coherently. So I think that's why it's so fun to talk to you today. Let's talk about value, though. I think that's where we wanted to start.
Sure.
You have some unique definitions of value or how you think about it. And for all those who are doing startups or thinking about tech development and stuff like that, this is probably one of the most important definitions of value that you get because it's the one that the people who are actually going to be using your device or your service or your product are thinking about themselves. Right. So how do you think about it?
So, I mean, in short, what is value? Something that you pay for. Something, whether you paid using your money or time, right? On the way here, I stopped at Starbucks, did a mobile order. What I paid for is as soon as I get into the store, I get my coffee, and that's what I paid for. And that's basically value to me. But if I had to wait in line, if I had to wait in line, or if I didn't get the right order, then that's something that I would say is not valuable to me. Obviously, for me to pay using my mobile app, that's value enabling. But for me, the value was having that cup of coffee in my hand. Similarly, you can use that example in different instances. For example, if you go to a doctor's office as a patient, what is of value for you is seen by the doctor for whatever condition you're there for, getting treated for that condition. Not necessarily the waiting in line, not necessarily for waiting for the appointment, or having to deal with your payer on benefits and authorizations and other things. There are times where you will have to go for some tests. Those are value enablers. But any of these waiting or extra processing times, those are your non-value added things. So what is value is that in healthcare, from clinician's perspective, the value is seeing the patient. From a hospital's perspective, to provide safe care. From a patient's perspective, to get that care and treatment as soon as possible. So if you look at value from all that instances, there's value from each and every individual that is within that healthcare system, whether you're clinical, non-clinical, whether you're a caregiver or care receiver.
But that value, I think what's interesting that you're pointing out, that value is actually the final end goal that you're going towards. It's not the incremental things that support that value. Right. They're necessary, right? Yeah. They're definitely necessary, but you're distinguishing between what is the final value versus what's necessary to support it.
Right.
Why is that important in your mind to make that distinction?
Because this is where I think as a developer, you can actually identify as you're trying to build a product, as you're trying to design a solution. In the opening statement, you mentioned I invented something, and I want to market that. That I, instead of being I, you actually are working with the folks that understand what is of value to them, what is the opportunity that they see, or what is the problem that they see in their daily life, whether it's a patient or the caregivers. So that's why it's important, because then once you understand that value, once you understand the problem from the consumer's perspective, you can design a product or develop a solution that's actually not only valuable to them, but easy to adopt, easy to sell, easy to market. Because people are already looking for that solution. People are already looking for something to help them bring value to whatever they want.
That's really interesting. It reminds me of any number of times we've seen people come along and they've said, oh, I'm going to do something and it's going to make some part of a process better. And they invent something and it's great. And in a world of their imagining, that thing will then save time here, save money here, or whatever else. In reality, oftentimes what happens is the clinicians carry on exactly as they have carried on, because it didn't actually change, I guess I would say, the value that the clinician is receiving or delivering. And only in some kind of intellectually perfect world would it have so changed the delivery of that value that it would have made a huge difference.
Absolutely, and that's one of the kind of a common observation that we have is that we in general in healthcare we get startups building products and addressing specific issues. However, if there was not a clinician's perspective involved, there is a possibility that that might not be utilized as much as you would want to, or might not necessarily add value to that particular clinician or the clinicians that are involved in that process. One of the things, let's say, for example, you add a checkbox into something, and I was just having this conversation with somebody about this, is that you add a checkbox about to reduce wait times or something. But for example, to get to that checkbox, it takes a few more clicks for the clinician to get to that checkbox. How likely is that clinician going to use that? However, if that checkbox was put in a place using the clinician's input as to, hey, will it be helpful if this puts it into a workflow prior to getting to that point? I think it would be much more valuable, and you will get the clinician using it more often than on the other way, right? So I think that's where you kind of have to have that clinician's perspective as you're building those products to kind of get what is of value to them, because obviously there is so many opportunities that we do on a daily basis that we see in our daily life and daily work. So
you brought up a very important word there from multiple perspectives, which is workflow. I think that's one that often doesn't get thought about. We've even seen in our practice the FDA asking that question more. And of course, they're not concerned about the market so much as they're concerned about the usage of the device, but a really, really important point. Well, as we talk about value, let's go in and ask the question, what does the health system value? What matters to them?
Sure. So as a health system, any bigger health systems, they value safe and patient care, whether where they are trying to improve the patient's experience, provide quality care, innovate, grow their business, and at the same time, being able to serve the community. That's of value to them. Those are usually the strategic goals of the organizations, if you will. They are the true north or the visions of the organizations, where those are in different organizations, there are different ways they're called, whether they're guiding principles or pillars, but those are the hierarchy that the hospitals value. There are several outcome measures or KPIs, key performance indicators, that align with those pillars, if you will, that people are trying to address, especially looking at those workflows, address those outcome measures or those what do you call the lagging indicators or KPIs. So that's where the health system's value lie. And when you have a product that aligns with those goals, definitely interesting. However, you do have to consider the other aspects, because obviously those value lie from the health system's perspective. But what about the providers that are doing the actual processes? What about the consumers that are actually consuming those services? What is it the value for them? How does that align? So yes, it could be successful from a health system perspective, but from a different perspective, it might not be as sustainable.
Because you have different stakeholders here, and the one that we're talking about here is health systems, but the patient experience has to be there and everybody else. Yeah. You mentioned things like the safety and quality of care, the patient experience, community service, innovation, growth. Those would be sort of top level things that a healthcare system is interested in and paying attention to. How about some of these indicators? You had mentioned before leading and lagging indicators. Give us some examples of those.
So basically the quick definition, the lagging is something that you achieve over time. The leading is what you do on a daily basis. A quick non-healthcare example is if I were to reduce 10 pounds in 3 months, that is my lagging indicator. The way I can go about it is work out every 2 to 3 days in a week, and eat salad once a day. Those are my leading indicators. So at the end of 3 months, if I were to achieve my goal, did I do all my leading indicators correctly? If I didn't, then did I not work out correctly? Did I not eat salad correctly? So understanding those leading indicators. And so that's how in the healthcare system you have, let's say, the patient experience. That's your overarching lagging indicator. You may have heard about Press-Ganey and other patient service surveys that are out there, whether you go to a clinic or to a hospital, after your visit, you get a survey. You fill that survey out based on your experiences. That score, or that score that the hospital, the clinic gets, that's your lagging indicator saying the patient experience scores is X%. But there are little components that align to those actual end score, and those could be those components could be patient-provider communication, cleanliness of the facility, noise at the facility, the wait times, instructions. All of those are your, I guess, leading metrics as well as process metrics, because they are the processes that align with the outcome.
That makes sense.
So similar to, for example, your patient throughput as an example, that especially with now just the way for the past couple of years things have been, patients are staying longer in the hospital. So that's a bigger concern for health systems. So folks are looking at the overall length of stay of a patient. But so that's the outcome, that's your lagging metric. But there are individual contributing factors. Those are the leading metrics. For example, if the patient is waiting on a test result, and that contributes to that, that's a leading metric. What is the turnaround time for the patient to get their medication? That is a leading metric to look at. So as health systems try to focus on their overarching outcome metrics, they try to focus on the individual contributing factors. And once they start measuring those, they can understand where they need to focus on, where they need to start doing process improvement, or build and develop any kind of solutions around those.
The last one you mentioned is really, really interesting, maybe because we experienced a year ago sort of the delayed test, not able to get a test with a relative, and days passed, and you're sitting there wondering, how on earth did this happen? But it sounds like something like that would actually, correct me if I'm wrong, would be like an overlapping case of various values. So, for example, to get the care that you're there to get is at some level perhaps even the most important value. But then there's also this patient experience thing of the duration of care. And so maybe it's not as simple as just saying, well, here's the exact metrics, because you can't just kick me out of the hospital without the test, or we'll have failed at the first thing, and you can't keep me there forever, or we'll have failed at the second one. How do you think of it? I mean, number one, am I right in sort of setting that up as an interrelated challenge? It is. It is,
because you have because healthcare is so complex. Your patient experience, quality of care, your growth, all of that are aligned, are intertwined together. So, in general, there are studies out there. The longer the patient stays in the hospital, their patient experience scores are going to go down. They're more likely to have infections, and then you won't be able to get another patient into that bed that the other patient is occupying. So now, it's a vicious cycle, because it's a multifaceted contributing factor that is causing for you to not address any of your strategic goals of the organization. So yes, you are absolutely right that it is intertwined, and so that's why one of the key things that we try to do is try not to boil the ocean, because it is so complex, that you try to start small and figure out, okay, one specific problem, whether it's the problem of the test, for example. Let's take that specific outcome and then drill down further into what is contributing to the delay in that test. And then from there, That's how you are then able to say, okay, now I've fixed that, now let me go to the other one. Otherwise, you will stretch yourself very thin and not be able to prioritize and address I guess the low-hanging fruits first, and then address the ones that need a lot more effort, but still will have a significant impact.
Yeah, it's really interesting, Santosh, because I imagine then, I don't think I've ever had this realization until you said that if I'm out there trying to bring a service or a product to a hospital system, not only does it behoove me to understand what the system's values are and to resonate with those, but if you're not trying to boil the ocean, then it means you're not interested in every possible solution all the time. You've got some priorities, you've got some things that are going to bring the most value to you. And if they're intertwined and interrelated, correct me if I'm wrong, it seems like you would actually have local priorities in any given year. And you're really, if you're looking for solutions, you're only going to be looking for solutions that are aligned with your, not values in general, but values for a specific, here's what our lowest hanging fruit that we want to attack is.
Yep, and you're absolutely right there, because you want to start at, obviously it's the goals are top down, but you have to look from bottom up to be able to say, here's where it's contributing. Yes, it might not be the only thing that's contributing to your, let's say, the patient experience, let's say the growth or anything, but it is one of the main factors. So you have to address that as you're building those products. That is where you see value from a daily caregiver's perspective that aligns directly to the top of that organization's goal. So from a clinician, and going back to your example of that lab test, from a clinician, if my patient is waiting on a lab test, I'm waiting. And that's one of the 8 wastes in healthcare. Waiting is one of them. And if I'm waiting, what is of value to me is I have that test result in my hand, and I tell the patient, okay, we're good, you can be discharged tomorrow, or if I'm seeing them in the outpatient setting, I read them the results and give them the whatever the diagnosis is. That is of value to me as a clinician. But if I'm waiting, that is where my problem lies. Yes, if somebody is able to come up with a product that speeds up the process of the test, that's great. But the problem could also be that I might not have interoperability with the system. So that now I'm waiting for the test results to be either faxed over to me, emailed over to me, or any of those. So now that is a problem. You may have developed the product that speeds up your test, but now there's still a connectivity issue.
And you as the caregiver are experiencing that problem, and that one is yet again discrete from the patient's value, from the healthcare system's value.
Exactly.
It's your own value as a clinician that's being addressed there. This is really interesting. The layers of this. It sort of shoots the classic. I'm going to build a product. I'm going to build a service. It's going to be great. Everyone's going to love it. Because now we're asking the question of, no, what are the actual values inside the healthcare system? And it may be the patients. It may be the systems. It may be the insurers. It may be the actual on the floor provider. I guess a question that comes to mind, you and I were chatting earlier about a conference that you went to recently. You're in this sort of process analysis discipline, and this is something that does exist in healthcare systems today. Would you say that the kinds of values that hospitals across the US, let's just take for example, that they are wrestling with and how they are prioritizing their values, would you say that those are generally aligned at any given period in time? Or would you say that they're very local things? And maybe this is not something you have insight into, but I thought, since you are engaged in this with colleagues across the country, is it something where people generally have the same values at any given point in time? Or is this really hospital system by hospital system?
I think you can generalize those, especially the quality of care. That's general. The value-based care, that is definitely general. However, it depends on, obviously, your where the hospital is situated, whether it's rural, urban, depending on the resources that they have. However, the opportunities they face majority of them are very similar. And that's why it is key to understand that even though the opportunities are the same, how are those opportunities being relayed to the problem solvers? Who are the problem solvers? And healthcare industry has been completely disrupted in the past couple of years. And so us to be able to focus on those problems, it's all, and still being able to provide the healthcare services that we need, you have to maintain that balance. And so you're right that it is, majority of it is general. There might be other geography-based problems that people may have based on their case mix and that's based on the population they serve. But majority of the overarching goals that I mentioned earlier, those are usually the same. But there might be some that, depending on the system, that they may have extras that are there.
So it's worth being aware of, but it's also the case that sort of large trends like, am I a rural hospital? Am I a hospital in a city? What are my demographics? Those are all still large operative players in what your value is.
Right. I mean, whether you're rural or urban, you want to make sure that you provide quality of care. You want to make sure that your patients are not staying longer than they should be. When clinically appropriate, they should be able to either go to home or to a skilled nursing facility or care. And so kind of, those problems are still being faced across the nation. So I think being able to understand that is key to building any kind of solutions that we could.
That's really interesting. Well, some of these indicators, let's make sure we talk through just some of these here, some that you had mentioned before, and have you sort of dive in on any of these that you think need expansion. You had mentioned the patient experience score, which you said was survey-based, hospital-acquired conditions, catching things in the hospital, grades, like everyone's heard of the U.S. News grade for a hospital, patient throughput that you mentioned earlier, how fast can we get them through the system, but still got to get full care. We got to give them what they're there for. Reducing costs. You had mentioned hand hygiene, the use of data and predictive analytics. Are we compliant with best practices? Right. And then we do want to grow this as a business, and so all of these things. Any of those that maybe need a little more elaboration or highlight as indicators or metrics?
I guess one of the things that I could kind of elaborate on is the hand hygiene one, for example. It's especially now with COVID and us just, I think, obviously we want to make sure that we're doing the right thing. One of the things that happens usually is that there are systems that are placed in, whether it's manual observation or electronic monitoring. We always start with the data. We start with data, which is great. However, there's another aspect to understanding why the compliance is where it is. So especially now, we want to make sure that people are washing their hands. So we do manual observation, or if there's an electronic system, for example, that provides you with a report that says X person or X staff member is at 50% compliance. We want to be at 100%. But there might be times where it's an emergent situation where it is not possible. You want to go save somebody's life to wash hands. But in situations where there are these reports that are put out that somebody's at 50%, they're not at where they should be, you obviously understand why that is happening. But majority of the time, because we're so focused on metrics, we're so focused on compliance, we don't always understand the reason why. And so these are your leading indicators that contribute to your lagging indicator of whether, let's say, not washing hands results in a bad survey or a hospital-acquired condition. So focusing on actually understanding why the person is not washing hands, why the person is at 50% compliance. There is a possibility the electronic system was not working correctly. There's a possibility that the person did not know that they needed to have certain things in place. They needed to replace their badges. There might be a possibility the batteries were down. I did one of the projects a few years ago the only way I could find that out, not just by looking at that 50% number, but actually going and observing. And in our lean world, we call it Gemba walks, to go and see where the work is being done. And that's one of the best way to understand the numbers that you're seeing, what is behind those numbers. And similarly, any of those metrics that you mentioned, those are great indicators, but we do have to take those with other aspects into consideration. Observation is one of the best way, speaking with the actual team members that are doing the work to get that information out. And that's one of the key things that we try to do is when we start with a problem or an opportunity within healthcare, we try to understand what the current conditions are. One of the ways to do that is by observing, by understanding the data, and then dig deeper to understand why the problem exists. So obviously me speaking with some of the team members, I figured out that there was a problem with the electronic system. There was a problem with myths or disbeliefs that were being spread. So things like that makes it that then you are able to focus on the root cause of that particular problem. And now, instead of the manager or the leader going and speaking to the person saying, you're at 50%, you need to wash your hands more. Now you're actually addressing the root cause, which is the monitoring system that is not working correctly because there was a dead battery. It could be as simple as dead battery. So fixing that, now you see the person is still washing their hands, now their compliance is actually going up. And so that also, not only that the compliance goes up, but now you've seen as a leader of that X person addressing that issue. Now you built a good relationship between the team member and the leader. Now you've got an employee engagement there. So to your point about how everything is intertwined within healthcare, yes, we talked about hand hygiene, but now we're also looking at employee engagement. So, going back to the piece of here's the solution, go do it, instead understanding what is the problem that that person was facing, addressing that is more valuable. And I think bringing that back to the solutions or the products that startups are developing is valuable, because now you understand how it's going to bring value to the actual healthcare consumer.
It's fascinating because I really appreciate what you said, which is basically just looking at numbers on a spreadsheet isn't going to get you to the depth of the interrelated complexities here. And I've often been impressed by healthcare systems that get people into their floors and look at what the problems are, whether it's the kind of problem solving that you're doing, or taking folks who want to do startups and saying, here, let's go walk the floor and find out what the issues are. It even reminds me, last year or a year and a half ago, we had Ron Williams on, who was the founder of MedBio, which is a medical device manufacturing firm in the area. And I remember I asked Ron, how do you manage your firm? How did you manage your firm as you were growing it? And he said, oh, it's management by walking around. It's getting out there and finding out what people's problems are, because then you're not only addressing the thing you thought you were going to address, like hand hygiene, but suddenly somebody feels listened to also, which actually does something. Hey, now my healthcare system actually cares about me enough to come ask me the question.
And that is one of the most valuable resource, sometimes underutilized in any industry, not just healthcare, is the people. Yes, they are there for their 9 to 5, they're there for their shift work. However, one of the key things is that the people that are doing the work know best how to improve it. So understanding, learning from them, listening to them, seeing what are the problems, and then they might not have the capabilities to solve the problem, but as a leader, as a startup, as a organization executive, you have those capabilities. So you could listen and you could actually solve those problems. And that's what brings me back to being a clinician, is that clinician being, whether you're a physician, you're a mid-level provider, you're a fresh out of med school, a resident or a fellow, or nursing staff, all our RNs, NPs, everybody, they are the closest to the patient in caregiving. They best know how to improve their workflow for themselves, their colleagues, and for the patients and families. And I think that's listening to them, understanding what are their pain points, is so valuable to building better processes, better solutions.
Well, let's talk about that. Let's talk about their pain points. I think it's a great segue to where we're going next, which is what are the near caregiver issues that people run into? I mean, what are the kinds of things? Now, these are all contributing factors to the things we've been talking about, right? They're all going to work their way back upstream to the kinds of metrics that the system cares about. But if we get right down to the walking around and talking to folks, what kinds of issues are they dealing with?
I think one of the things that they usually deal with is, I guess, going back to the example we started with, the lab test. There's a possibility the system that the lab is using doesn't talk to the EMR that the provider is using. So that interoperability is an issue, and then that causes delay in the patient's waiting, the provider's waiting. And so that is a big issue where you have different systems that don't talk to each other, that are still being, within healthcare. So I think there's a big push for interoperability within healthcare between different systems. So I think that's one pain point that I could think of. Other pain points also is a lot more manual work, if you will, a lot more administrative work. I think that is one of the main things, is that as you're doing, patient caregiving, if there are a lot more manual work that you're doing, you're being taken away from the patient, and you cannot utilize your time, which is valuable to provide the valuable care you need for the patient.
When you say hands-on work, you're talking not about hands-on work with the patient necessarily, but hands-on work just to comply with something else.
As an example, for example, you have to go get supplies. There are supply rooms in each inpatient unit, but you have to go to a supply room that's further down the unit, because the supply in this supply room was not available for you to get that. So now that's another waste in healthcare, where you have extra motion of the nurse or the nurse assistant or the clinician from the patient room to the first supply room, not being able to find a supply, whatever they needed for the patient, now going to the other area and trying to find that. Now there's time being wasted, there is movement, and the patient is waiting for whatever they needed for their care. So those are some of the things. And then also, if there are any kind of, we talked about being compliant. If there are any compliance audits, especially we want to make sure that our team members are compliant with the work that we do. But if there are these audits being done on paper, if they are being done on a piece of paper, somebody is actually printing it out in the first place, doing the audit, then either scanning it or sending it to somebody to pull all that information together to be able to provide that leading indicator we talked about into a metric. Now, all of that could be automated by building a smaller solution of something that could be as simple as an app on a device, or could be something that could be pulled up on a computer that the nurse or the caregivers are using, that does not require manual entry. Might still require manual entry, but not necessarily manual entry on a piece of paper. Then that creates a problem with data validation sometimes, because if you're using paper to audit, you might miss some of the things. But if you have an electronic monitoring system, you still have a better way to do that. So you still have that human check, but you are able to create that automation that reduces that manual work, reduces that time utilized to do the audits. And then you are still being able to understand where we are with our compliance. So automation is a big opportunity that folks have, and I think a lot of health systems are spending some time and resources around it.
On automation. I guess automation is great as long as it does become and stay interoperable, right?
Right.
That's kind of the big question there. Does it plug and play?
Exactly. Interoperable automation that makes it so that now a nurse or a provider, whatever time that they are there for, they actually have more time with the patients than the other administrative manual work that they do.
That's a huge thing. We started out talking about value and how do we define healthcare value, and what you've just been telling us about is really non-value add, right? It's, hey, this is, I'm doing it, I gotta do it, it's gotta be, oh wait, but this isn't adding anything to the process.
Yeah.
Tell us about that. You have some interesting thoughts on what's non-value add, and I love your approach because it's looking for those kinds of things and saying, let's get rid of it. Yep. You're not trying to do this fancy schmancy stuff. You're just saying, where's the waste, right?
Yeah.
You've got some processes. You also mentioned 8 wastes in healthcare. You can actually categorize where do healthcare systems waste their time and their money.
Right.
So I guess start with either one of those, either problem-solving approaches or the 8 wastes of healthcare. But tell us about what's non-value add. What are we trying to kill here? What are we trying to knock out?
So first of all, thanks. That's a great question. Because like value is 3 ways. Basically, it's value added, value enabling, and then non-value added. Mm-hmm. You want to optimize as much as you can the value added things. You want to minimize the value enabling things. They're necessary, but you want to make it so that they're the least ones.
Yeah.
And you want to get rid of the non-value added things. And those non-value added things, I would say, the 8 waste in healthcare, there's an acronym, it's called downtime. It is defect, and I want to make sure that I said it correctly, overproduction, waiting, non-utilizing of skilled talent, transportation, inventory, motion, and extra processing. Again, we talked about waiting. We talked about.
I think it's the first time I've ever heard an acronym for what do they call them, NOMNICs or whatever, to help you remember it, that actually relates to the downtime. Yeah, that's great. Sorry.
Yeah, no, that's okay. And I think it's easier to remember, but also it's kind of, it's interesting because all of those, like the conversation we've had so far, we've talked about motion, people going from one place to the other, walking over because they couldn't find it. We talked about waiting for lab tests. We talked about defects being transferred from one place to the other, the information not being translated correctly. And if we were to overprocess information, which is not necessarily needed, creating extra time slots for either appointments that are not necessarily needed. Just all of those are non-value added things from several perspectives, from a provider's perspective, from caregivers, from patients, from families. So those, looking at those, understanding those 8 wastes in healthcare, and then understanding how they relate to your daily work. Then you start to kind of think about, how do I do this problem solving? One of the key things I think would be helpful as a clinician is to have that problem solving thinking. As a clinician, you receive a patient, whether it's outpatient or inpatient, you're seeing a patient, they come to you, they present to you with a symptom or a chief complaint. That is the problem that you start with. Then you start with the background of the problem as to, like, okay, person comes in with headache. You start to understand, okay, what is their background? You kind of get their medical history. And you try to understand their family history. What are their social habits? So you try to get a good understanding of their current conditions, their background. You try to see if there's any kind of data available, right? They might have some information from other institutions that you want to pull all that together. Now you want to say, okay, I want to treat this patient. I want to make sure that their whatever symptoms are treated. That's your goal as a physician, as a clinician or caregiver, right? But then you try to understand why these things are happening. That is the key. That is your root cause analysis as a clinician. When you do that, you're trying to do lab tests. You're trying to do diagnostic procedures to understand why this patient is presenting with this particular symptom or signs, right? Once you figure out, based on the lab test, okay, this person needs X number of treatment, or let's say they have high blood sugar. Now you know exactly what you need to treat it with. However, you also want to figure out why they have a high blood sugar, right? You're trying to figure out if it's a family history, if it's genetics, if it's something else that they need to. So you try to prescribe medication and treat it based on that. Then you try to kind of say, let's figure out follow-up, do a second, follow-up visit. You try to make sure that everything is okay, and if the patient is following the protocols of the treatment. What I just mentioned is a problem-solving thinking. It is an PDCA, which is Plan, Do, Check, Act. It could be fit into an A3. So as a clinician, as you're doing your analysis and actual understanding of a patient and helping them treat them, you're also have a great insight of your daily work. If you apply that exact same thinking of problem solving, not only just for treating patients, but also improving healthcare, you could be one of the best resources to identify opportunities within healthcare that startups can actually use to build better products.
Even as a physician there.
Even as a physician.
Yeah, that's interesting. Well, that sort of bridges why ArborHive, as an organization of bringing physicians together to think about innovation and to say, I think to empower.
Exactly.
Right, to get people thinking, hey, I can be part of the solution here, even if it's not my job title.
Right.
But I can empower that. I know you do a lot, both in your everyday job and also through ArborHive, trying to empower and train clinicians to see opportunities and to do something about them. How do you approach that? And before you answer, I just want to say to the audience, as we come up towards the top of the hour here, if you have questions for Dr. Mudiraj, please feel free to raise a hand, type them in the Q&A. We'd love to get your questions answered as to what does he actually see inside of healthcare systems. I think it's a fascinating question. But yeah, how do you approach that, empowering clinicians either in your day-to-day job or in your work with ArborHive? How do you think about that training?
So, I think one of the key things is that the approach would be that this problem-solving thinking is not different than what you, as a clinician, do on a daily basis. It's the same. What you're doing right now is treating patients using that same thought process of problem, background, current condition, why the problem exists, solution. If you apply that exact same thinking as a clinician, then you are also looking at your surrounding and understanding how can I apply that same thought process of problem-solving thinking to bring value to myself, my colleagues, my patients, the overall health system, and the community for that matter. So I think training-wise, obviously, you can get trained around A3s, PDCAs, lean or other things, but it's not necessarily different from what a caregiver does on a daily basis. You always want to meet with the patient to get a better understanding with them. So I think that's one of the key is how do you actually go and see the daily work. And that's why I see clinicians being in this key place to help healthcare not only improve but bring value to all the healthcare consumers, including themselves.
Yeah, it's an amazing thing to be able to do, and it's an often neglected one because so often in the innovation world we have either the rare clinician who steps out and says, I want to do this, or we have people who aren't even clinicians saying, I've got this great idea, but kudos to you and also the ArborHive team for trying to think that way and get other people to think that way, because your point being that no, problem solving is problem solving. You just have to understand what the inputs and the fixed points are, and then you can navigate just the way that you've navigated everything else in your life.
And this way they can collaborate with others. They can collaborate with other clinicians that are in that same boat. They can collaborate with other healthcare change agents. Whether it's a physician, a nurse, or somebody who has experience in the operational world of healthcare, they all see the problem from different point of view. But they see the same problem. So then they might have different perspective of why that problem exists. And working together, you can then pinpoint to the developer or a startup to say, here's where we see the problem. And those developers can build a better product using those insights. Right now, I think that is one of the key things to do. And that's where ArborHive are situated in such a great place to be able to provide that insight to the startups to connect that gap.
That's really interesting, and that's an example then of a pull, like we discussed before. It's a pull from the healthcare system, from multiple points within the healthcare system, saying, "Hey, I see this problem. Yeah, I see that problem too. Yeah, I see that problem," and then everyone's sort of coming together and saying, "Where can we get that?"
Right.
Rather than a startup coming from the outside saying, "You guys need this. I just wanted to let you know," and everyone's like, "We weren't aware."
Yeah.
Have you seen examples of that pull working? Are there places where you feel like that's been able to be successfully done, or at least to get agreement within the system?
I think there are some, using emerging technologies, there have been some areas where teams have actually utilized data as well as some of these problem-solving thinkings to kind of do the pull, where we have institutions that are putting, soliciting ideas from caregivers to understand what some of the problems that they're facing on a daily basis, and then adding data to it, their outcome metrics, and then being able to have innovation hubs within their institution build products around those, build solutions around those.
Yep.
I think that's where I've seen those. But yeah, you're absolutely right that traditional, here's a product, we will market it to the customers. That's not always as successful now, especially within healthcare. We have to have that pull to better understand what the product should be.
And having an interface layer there where the clinicians can go so far and they can identify the issues, but to have an interface layer like a innovation department or something where people can start to think about that problem and start to reach for the commercial aspects of it, that could be a powerful thing.
Yeah, and that's where the ArborHive, clinicians working together help connect those dots. Being able to say, here's where some of those key points are, and then provide that insight, provide that feedback.
Yeah, that's huge. Well, Santosh, in the last few minutes we have together here, I want to give you a minute also to tell us about some of your efforts. I know there's stuff that you're working on developing, independent of the day job, independent of ArborHive. I think it's always fascinating to hear where people are trying to solve the problems that they see. So I'd love to hear a little bit more about that in the few minutes we have left.
Thank you. I mean, one of the things that we discussed is that having a collaboration between clinicians, because I always see that in organizations, whether it's healthcare or non-healthcare, we do get leaders looking for inputs from front lines. Especially in healthcare, we have ancillary staff. Getting a lot of input from them is always very helpful, helps us run the system smoothly and operate great. However, I do see, because of the amount of work our clinicians, our caregivers, and when I say clinicians, I want to generalize it to physicians, or nurses, or residents, and others. They're so busy, especially in the past few years. It has been, they've been so strapped with resources and time that they've not been able to think beyond that aspect of problem solving, of caring for their patients, to actually think about what they could do differently to make it easier.
We're surviving, we're not innovating at this point, right?
Right. So for them to be able to do that, so that's what I'm trying to do is kind of build a product that connects those clinicians, connects those healthcare change agents together, build a community there, and provides a platform where they can either, if they have an idea or if they see an opportunity, not necessarily a solution, at least an opportunity that they have, that they could say, here's what a problem that I see on a regular basis. So we are able to kind of get that and connect them together to brainstorm and say why those opportunities exist. They can talk to each other. The clinicians can talk to each other. The change agents can talk to each other. And then also potential developers. Startup developers can connect with them to say, okay, now we see a problem. We see a bigger trend here. Let's hone down on those specific aspects that all these healthcare, I guess for lack of a better term, change agents, including clinicians, are talking about. let's build a better product for that specific aspect. So I'm trying to build a platform there to capture that information, because, as I said, the people that are closest to the work know how best to improve it. So that's my motto with clinicians, and I want to focus on the clinicians, especially me being a clinician. I've seen those things, and and I know a few others, including the ArborHive team, who are trying to do that. So I'm trying to build this platform. We're still debating on the name for it, but I'll be out soon. So
that's very cool. Well, communicate, right? I mean, that's the thing, and people oftentimes don't even have that first level of empowering, and it's fun to see you in all your roles trying to empower people to even think that this is worth talking about,
right?
And then to give them the tools to talk about it and to say, here, let's have this conversation.
I think empowerment, when we hear that within healthcare, we think about the patients, the families, and communities, and that's definitely one of the key things that we have to do. But we also have to have empowerment of our staff, empowerment of our clinicians, so that, again, they're the closest to the work. They know how to best improve it. They can help us improve it. So I think that is where it's key to empower healthcare consumers in general, including the caregivers.
Yeah, that's a huge thing. Well, I think it's really cool because what you're doing with ArborHive too. One of the questions I sort of wanted to ask was, and it's been asked a lot, is how do startups and innovators get in contact with hospital systems? It's a very, very hard thing, because oftentimes, even if you can talk to somebody in a hospital system, it's the wrong person to tell you what the issues are. And I think that's what's so fun about what you guys are doing with ArborHive, is you're not talking to a specific hospital system, but you're able to go and talk to folks who are clinicians, who have those exposures. They can give you some pretty good guidance in terms of how it goes. So I wish you guys the best in that, because that fills a real need that we often see with startups and innovators.
Thank you.
Very cool.
Appreciate it.
Well, I think we're at the top of the hour here. I appreciate our audience for being with us today. Thank you for attending. We have one more week of the clinician's perspective next week with Frank Sawyer. But today I'm going to leave Dr. Santosh Mudiraj with the last word. What do you want us to take away from today's session?
There are opportunities everywhere. Just, you don't have to look for it. They're right there in front of you. Continuously improve. Do better than what we did yesterday. And if you don't know or don't have the resources, connect with somebody. Connect with ArborHive. Connect with your peers, and they can help you build a community that you eventually become a problem solver yourself.
Get up out of that chair and go do it.
Yep.
I love
Let's
it.
do it.
Dr. Santosh Mudiraj, thank you for being here with us
course.
today.
Thanks so
Appreciate
much.
it in
Appreciate
person.
it.
Thank you for being with us here on MedTech Crossroads. We will see you next week. Have a great weekend.